The box plot that both you and I are looking at right here may not make a lot of sense right now, but we'll help clear that up a little bit in a few seconds. This represents the fear recall index. Now, this is a very positive result. Now, what led to these results? In reference to, and how does this affect individuals suffering from PTSD? Well, we're going to get to that, and I'm sure that this will clear quite a bit up for you. Now, without getting too technical, we are looking at the results of a blue light at a wavelength of 469 nanometers at 214 lux being presented to an individual at a 45-degree angle at arm's length for 30 minutes a day for 6 weeks. The results were just astounding. So much so, in a portion of the brain known as the insula, you could actually see the differences between certain areas being activated, bilateral per se, in reference to the different color light. Now, let's get right into the study, and we will come back to helping define fear extinction recall. That's a whole debate about how to basically work with PTSD in individuals not necessarily forgetting something, but supplanting fear conditioning with fear extinction recall. But without digressing or going too far, let us begin. Here we go. Right off the bat. Ba-bum. Morning blue light treatment improves sleep in patients with PTSD. University of Arizona Health Service Science researchers explore a non-invasive, drug-free treatment that offers hope for healing from the severe symptoms of post-traumatic stress disorder. You could really see the researchers here, their desire to help improve the human experience. So to proceed, people with post-traumatic stress disorder experience better sleep, a reduction in the severity of PTSD symptoms, and more effective treatments after exposure to blue light therapy, according to the new study conducted by the researchers. Study participants, this to kind of reiterate, study participants committed to 30 minutes of morning light exposure daily for 6 weeks. And I know blue light has a lot of a bum rap in reference to computers and so on and so forth at night. So keep in mind, the timing is in the morning before 11 a.m. 30 minutes of morning light exposure daily for 6 weeks, with half the participants using blue wavelength light and other half, obviously, using amber light. Researchers examined neurobiological, autonomic, and behavioral outcome changes during the study. We're going to go to the full study because it explains a little bit better, so let us proceed. The 43 participants who received blue light therapy not only demonstrated significant improvements in the severity of the PTSD symptoms, but also reported improvements in sleep and showed an increased retention of fear extinction memories. Where the other ones, the amber light, not so much. I am going to veer from course for a second to show you a definition of fear extinction compared to fear conditioning from another study from the National Library of Medicine, which says an excellent excerpt. The excerpt goes as follows. Whereas acquisition of fear conditioning increases fear responses, fear conditioning, to the conditioned stimuli, extinction decreases the fear responses. So, fear extinction recall is actually a good thing. So when you hear that, they're trying not to imply that someone is forgetting, but basically reversing or basically mitigating the conditioned responses which were triggering the PTSD prior. Huge debate on what to call, how to call it, what to call it, so on and so forth, but that gives you an example of why the researchers labeled it as such in the study. Now, I'm going to show you a picture of the study, an excerpt from the study. This is the one that shows you the blue light. If you could read it in 4K, the 469 nanometer wavelength at 214 lux. It shows you a pictograph of how it was done. Again, 45-degree angle at arm's length. Yeah, that can add some confounding with different types of arms, but let's keep it simple. And so on and so forth. Great little graphic from the full study. Now, to proceed as well. All units were identical in design. I'm not going to read through the entire methodology here. Let's go to what they utilized, which was no funding. This was a military study. To proceed, the Go Light Blue Energy Light towards the bottom, you read there, has a narrow bandwidth peaking at 469 nanometers at 214, and it gives you the radiance and so on and so forth. Not a sponsor of any particular product. This just happens to be the light that they utilized in the study to achieve the outcome which we are now relaying to you. Now, the conclusion in the full study. The present study examined the association between 6 weeks of daily morning blue wavelength light relative to amber wavelength light placebo treatment. Overall, quoting, we found support for the hypothesis that improvements in sleep would be linearly correlated with improvements in PTSD symptom severity. Furthermore, the findings from the fear extinction task support the global hypothesis that blue light therapy improves autonomic reactivity and brain function in a manner that aids in fear extinction safety memory, even across longer durations of time than this type of paradigm is typically employed. This is especially important as safety learning is critical to recovery, and several prominent evidence-based treatments for PTSD are based extensively on principles of fear extinction. That one study I showed you, which defined it, was from 2008, by the way. These results suggest that blue light therapy is a promising non-pharmacological intervention that may potentially facilitate the retention and treatment gains from exposure-based therapies by resetting the circadian clock. This is a good, strong hypothesis. And improving sleep in a manner that promotes consolidation of extinction memory. That hypothesis in regard to basically resetting the circadian rhythm, improving sleep, and allowing the healing process to take place is fairly detailed in the full study itself, should you decide to review. Now, back to the public release, and this is where it says it is said the best, or communicated, I would say, coherently the best. The data are thrilling. Quote, the non-pharmacological intervention is a promising, life-changing, and life-saving possibility for people suffering from PTSD. And that is a golden statement for individuals which are looking to help improve therapies in which there is no profit for them, but basically the simple desire to help improve that human experience by accelerating the healing from quite traumatic experiences. Again, that's incredible. This is stuff which I would like to see eventually make it into headline news channels, knowing all the individuals affected by PTSD that can do something like this as opposed to basically, I would say, a pharmacological intervention. A non-pharmacological intervention like this is just incredible, provided the timing's right. 469 nanometers, 214 lux, arm's length, 45-degree angle, 30 minutes before 11 a.m. Voila. Again, gratitude to the researchers. Wonderful. This can help a lot of people in almost an immediate, incorporation into general treatment paradigms for doctors looking for safe, effective ways of helping their patients very, very subtly in a beautiful, beautiful way. Gratitude. Thank you. And I look forward to see you all once again next week. See you then. Bye.